The treatments were permitted Monday by a Congo ethical board on the perspectives of Merciful utilize. Such a treatments include never been wide accessible or utilized for an Ebola outburst, the Planet Public Health Organization told Environment. At low one of the drugs was utilized on a bounded base in the 2014 Western Africa outburst. Down there include been 58 cases of Ebola informed, consisting 27 deaths, with the outburst was proclaimed May 8. 37 cases include been affirmed in lab tests. Monitoring of the outburst has concentrated on efforts such as patient insulation and thoroughness, pin trace, society knowledge and the use of in-pilot vaccination, RVSVZEBOV. Vaccine began in the city installation of Mbandaka and distribution to village regions Love Bikora, wherever the outburst began. Recent 1 week, who was carefully upbeat on the outburst, as Mbandaka seemed comparatively protected and officials hadn't seen an blasting growth in cases, told Dr. Peter Salama, the Vice CEO General of WHO's Emergencies Program. Several of the treatments need 4 injection time, other need everyday evaluation of liver disease and renal feature, on to Dr. Michael Ryan, WHO aid CEO General for Disaster Readiness and Answer. Use of the drugs will as well shape portion of a clinic test to evaluate their efficiency and report use in next outbreaks. In 2014, ZMAP was utilized to consider 2 US missioner workers, Dr. Kent Brantley and Nancy Wrightbull, who contracted Ebola in Liberia. Previous, the pilot narcotic had been proven just in monkeys. It was after utilized to consider some patients for the identical outburst. Vaccine, therapy and monitoring efforts include and will be transferred out via partnerships among WHO, the World Federation of the Red Crucifix and Red Crescent Moon Societies, Médecins Without Frontières, Doctors Out of National Borders, and some non-government organizations on the land in Congo. Ebola viral infection illness, that largest usually affects human beings and in human primates such as monkeys, gorillas and chimpanzees, is inflicted by one of 5 Ebola viruses. On 50% of human beings who be ill in Ebola dead. The illness is predicated to the more Democratic Republic of Congo, and the is the nationality's 9 outburst with the opening of the viral infection in the nation in 1976. Humans can be contaminated by some humans if they go in physical fluids of an contaminated man or polluted objects of contaminated persons. Humans can as well be vulnerable to the viral infection by, for example, butchering contaminated animals. Western Africa skilled the greatest written outburst of Ebola above a couple-year time start in March 2014, a full of 28,616 affirmed, possible and suspected cases were informed in Guinea, Liberia and Mountain Range Leone, in 11,310 deaths, on to WHO.